I'm Dr Phillip Katelaris. I'm a urologist, a urological surgeon, and I've had the good fortune to work at the Sydney Adventist Hospital for nearly 30 years. Erectile dysfunction is the inability of a man to achieve and maintain an erection sufficient for vaginal penetration and orgasm. Unfortunately, it is very, very common. Men in their 40s have about a 30% incidence, and it increases by about 10% with each decade, such that men in their 60s and 70s have well in excess of a 50% incidence of a degree of erectile dysfunction. The chief cause is vascular, and this relates to lifestyle. The little penile arteries are very sensitive to narrowing. So if you're overweight, and you don't exercise and you smoke, and your blood pressure's high and your cholesterol's high, you are at risk of erectile dysfunction. So there's a very strong public health message here. If you're 50 and you have a softening erection and you do not modify your vascular risk factors, your chance of a heart attack over 5 years is 3 to 4 times higher than a 50-year-old man with normal, healthy erections. Very important public health message that I always like to stress to men. Sure, we can treat your erectile dysfunction, but let's think about the rest of your body as well. Erectile dysfunction is not a man's problem, it's a couple's problem. It can have a devastating effect on a relationship. What happens is that the man's erection starts to fail, and he won't admit it, he won't talk about it, and he starts to shut down. He withdraws from his wife emotionally. She feels rejected, she feels unattractive, and soon there's a coldness in the relationship, and a once happy marriage has cooled right down. A lot of my patients come at the insistence of their wives, and it's a good thing that wives go on the front foot and insist that something be done about it, because men are too ashamed sometimes to come and talk about it. And what I say to them is it's not a matter of shame, it's a matter of treating a medical condition. If you can't see properly, you get glasses. If you can't hear, you get a hearing aid. If you're having trouble with your erection, you see an expert, and these days all men with erectile dysfunction can be treated. So the message here is don't put up with it, don't inflict the unhappiness at home. Come forward, let's treat you and get you back to how you once were. It's a very sad thing to see a good, caring, intimate relationship cool because a man has become avoidant of physical interaction. A lot of men say, I don't want to start something I can't finish. There's a feeling of inadequacy. So it's very important that couples come forward, realise that this is a treatable medical condition. It's very important that general practitioners ask patients about their problem. And it's important that patients are then referred to a specialist who is prepared to talk to them about the issues and to institute treatment. And if we adopt this program, we will end up with very happy patients and very content relationships. Because even though we're all growing older, sexual interaction remains a very important part of our physical and emotional interaction together.